everybody. My name is Katy Bryan. I am on the board of the Benjamin Rose Institute on Aging, as well as the president of the Young Professional Council for the Benjamin Rose Institute on Aging. And if you haven't heard of BRIA, which is our acronym for Benjamin Rose, or you've heard of us and you really don't know much about us, then you don't need to feel alone, because a lot of people are still wondering exactly who we are and what we do. So I'm hoping today that you guys will get all of the clarity based off of our interview with the executive director and president, Orion Bell, of the Benjamin Rose Institute on Aging. And he's here to answer a lot of our questions and hopefully leave you understanding a little bit more about who we are and what we do. So thanks so much for joining us today, Orion. This is a real treat, and I know that your time is precious, so thanks for having us today.
Well, thanks, Katy. I'm glad to be here. It's a good opportunity. I always like to talk about Benjamin Rose.
Good, good. Well, we like Benjamin Rose and we like to talk about it too. But before we dive into that, what I really want to share with people is who you are, because you are new to Cleveland. You and your wife, Beth, joined Cleveland in March last year, 2019, so that you
April of
could take over
2019.
this role. Wow. And so I'm sure it's been a roller coaster of a ride, especially in the last few months, but we hope that you've been able to settle in a little bit and get some good food and get a little sense and taste of our Cleveland atmosphere. But you come to us from SECOA, which is the Central Indiana Agency on Aging, realistically, as well as helping families and special needs adults. Is that correct?
Right. So we were the area agency. I was the CEO of the area agency on aging. It served Central Indiana. It had a similar population coverage as to what Greater Cleveland would be, about 1.8 million people.
Wow.
And so we provided services for older adults and caregivers, in addition to people of all ages with disabilities.
Wow.
So,
and I know that you had quite a big staff. So you had over 270 staff members that you were in charge of, as well as like a $27 million budget that you were in charge of to run that agency. And then above and beyond that, you were there for about 11 years. And then prior to that had worked as the chief officer, executive officer for various Red Crosses across the nation, from Texas to Kentucky to Kansas and even here in Ohio. So over 25 to 30 years of great leadership experience and working with the community. So we're privileged to have you here in Cleveland and can't believe that we got you.
Well, thank you. It's fun to be here. I would just say on the Red Cross part of it, say that even in my Red Cross tenure, I did a lot of work with community programs for older adults and caregivers in the Red Cross chapters I was in. So even though I wasn't always in aging services, I always had some programming and some involvement with senior programming in the community and programs that were funded through the Older American Act, like the things that Benjamin Rose does here in the Greater Cleveland area. So it's always been a part of my career before coming here.
Nice. And before we get into it, so what made you so passionate about working with the Aging Society and the aging population?
You know, I think like a lot of people, I just kind of ended up there. You know, I don't think I ever said I was just set out to work with older adults or work with people with disabilities or do caregiving services. But I think like most of us that are in the field, we all have a caregiver story. We all have some involvement with a loved one, a family member, someone close to us, where we got introduced to some of the challenges of people maintaining their independence or the responsibilities of being a family caregiver. And so I think, you know, that your interest and your life experience informs the things you do as a career. One day you look around and it's the work you do. So, so I think, you know, and Benjamin Rose has a wonderful reputation. You know, coming to Cleveland from outside of the area, Benjamin Rose as an organization has a terrific reputation as a service provider, and in the research we do, and particularly some of the work we've done around caregiving supports and elder justice and applied programming in that space, that there's a wonderful reputation of the organization. So as thinking about a place to go, it says, well, that's one of those pinnacle places to be. What a wonderful place to be if you work in this field. So it's been a real honor to come here.
Good, good. So you touched on it a little bit, but tell me a little bit about the background of Benjamin Rose Institute on Aging, as well as who we serve just in the Cleveland community, let alone nationally.
Yeah. So, the Benjamin Rose Institute on Aging was founded with a trust that was established by Benjamin Rose, who was an industrialist here in the greater Cleveland area. He was actually originally in the meatpacking business. And among other things, was one of the first to introduce refrigerated rail cars and those kind of things in terms of being in meatpacking. So was a business innovator in his time and very successful, and then got into other areas of business, including real estate and other businesses. And his interest in older adults came about because as he grew older, he learned that business associates of his, people who he had worked with, people that he knew, fell on hard times. And back in 1908, in the days before Social Security and the days before Medicare, very often if someone did not have financial means later in life, that their home was at risk. They run the risk of not being able to maintain their independence. And he and his wife decided that's what they wanted their legacy to be, that they would leave their trust in the Benjamin Rose Institute specifically for the purposes of looking after older adults and caregivers, with the idea that people deserve dignity and independence and security in their later years of life.
Wow.
And initially that was providing pensions and financial support for people that didn't have one. And over time, the organization, as it served older adults, as it met the needs of that population, we began to get involved in other kinds of services in the community. So we started residential care homes. At one point, Benjamin Rose Institute operated a hospital for geriatric patients in the greater Cleveland area. And we were in nursing homes and home health care for many years. And at one time, a nursing home was considered the state-of-the-art way to address the needs of an older adult with poor health. And that's not considered the state-of-the-art anymore. And Benjamin Rose moved away to more community programming, but always with the idea that it was about what met the needs of that population, that we were always independent of a particular religious denomination or a particular hospital system or a university, but we've always been interested in the needs of that population. We've always had an interest in research and best practices around the needs of older adults. And we've always had an interest in applying the research to best practices and delivering community services. So, going back to the earliest days of the organization, that's always been an important element for us. And so one of the things that is a legacy of this organization is something called the Activities of Daily Living score, which, if you work in aging services, it's a scale that helps determine a person's functional independence, their ability to live safely and independently. And it was developed by Dr. Sidney Katz, who was with the Benjamin Rose Institute, as a way of determining a reasonable health score for a mature adult, because up to that time, most of the focus around health had been on development. So it was like child development that didn't apply to an adult. And so the Activities of Daily Living score became a way to do that. That's just one example of the kind of innovations that have come from the Benjamin Rose Institute. Right. And in more recent years, as we've focused more on community programming, and as we left the nursing home industry and we left the direct health care components, we've added some other services. So a few years ago, the Rose Centers on Aging Well, which formerly had been the Golden Age Centers, which were community centers around Cleveland. Today there's 7 of those locations that offered a variety of educational programs and social programs, as well as being Meals on Wheels for much of greater Cleveland, and congregate meal, neighborhood meal programs for folks in that space. And today a lot of intergenerational programming. And then a few years after that, we merged the ESOP program, focuses on financial education and financial independence. And because many of ESOP's program participants, the folks who benefited the program, the median age was age 55. So seeing that there were a lot of the challenges for people's financial independence that affected their ability to grow old with independence and dignity. And, in our country, a lot of your decision making around everything from healthcare to where you live and what you're going to have for dinner on Thursday, those are as much about your financial ability as anything else. And so that was a logical connection for us as we thought about how do we have an impact on the quality of life of older adults in the greater Cleveland area. So those are programs locally. And then around the country, we have about 60 licensed sites in communities all over the U.S. that focus on caregiver support programs, such as our BRI Care Consultation, or research projects that we do with elder justice and assisted and adult protective services and other program supports, again, aimed at supporting vulnerable populations in communities around the country. And because of that, we participate in a variety of senior advocacy and elder justice and support programs as the Benjamin Rose Institute. So we're involved in advocacy for the population, we're involved in direct service, and we are involved in research on what works in the population.
Wow. So, there's just so many things that we do. It's no wonder that most of the time, people are wondering what the heck it is that we do, because there's so many things that we do. But I would say, even having served on the board for the past 5 years, just knowing that we have an impact on community, that at the Rose Centers, they're doing education, they're providing meals, they are providing direct programs of bingo events, books and things like that, having caregivers come in, that it's so important and so essential for seniors in our community to have that accessibility to be able to go to a place and have those programs. With COVID and everything, I'm sure that it's been more of a challenge for seniors to get out of their homes. So tell me a little bit about the importance of remembering our seniors in this time too.
So, Katy, that's a great point, because one of the challenges has been that a lot of our programming is community-based. It's designed to be things where you bring people together, and for the last few months, it's been difficult to do that because of the concerns about the coronavirus, and particularly as it impacts older adults. So, in some cases, we have gone virtual with some of those programming, where people might participate over the phone or across a website. We've done a lot of telephone outreach for folks who we might have seen in a center or seen in a program that'll come in. In the last few weeks, as situation has allowed, we've had some face-to-face services that have restarted, particularly some of the counseling services and tax preparation and some of those kind of things that we could do. But many of our folks still rely on us to reach out to them remotely through telehealth and those kinds of activities. We converted a large number of our folks who maybe had lunch with us at a Rose Center or in our adult day programming became clients on a home meal delivery route. So we effectively doubled the number of people that we were providing a meal to in the home as opposed to them going to a center location. And we've been coordinating with other meal providers, working with the Greater Cleveland Food Bank, working with some of the other Meals on Wheels affiliated organizations in Cuyahoga County to help make sure that meal deliveries could take place and that we managed to find a way to get to people when the precautions around the coronavirus made that more difficult for some than it had been. Okay. So there's been some neat opportunities. We've done some fresh food delivery. We've done some proxy shopping for people that, for safety reasons, really can't get out. So we found some ways that we can help meet the needs of that population who've really struggled with the challenge of being you know, homebound or sheltering in place or practicing social distancing. It makes that difficult for them.
Yeah, and that fresh food delivery is really important too, and was something I hadn't honestly thought about in regards to we're providing a meal, but is it the most nutritious meal that they could be getting? Because we know that seniors oftentimes struggle with being able to prepare a healthy meal for themselves. So I know that's another initiative that Benjamin Rose and the Rose Centers has taken on as well. You know,
Well, you know, and one of the most important parts about a meal program is that when we survey clients in those programs, very often you will hear that there are days when the only other person they talk to that day is the driver that delivered the meal. So beyond the meal itself, there's also the opportunity to connect with the person, to check in with them, to have even just a brief conversation at the door, but some opportunity for some connection. So a lot of opportunity through telephone reassurance and outreach just to make sure that people aren't forgotten. In the best of times, these are folks that sometimes fall off our radar. We don't see them because they're not as mobile, they're not out in the community as much. And so they're especially vulnerable at a time when those kinds of access are more limited. And so we think that's a very important part of the mission during the pandemic.
yeah, no, for sure. You know, for the aging population in general, you know, the baby boomer population is the largest population next to the millennials who kind of surpassed them. But, you know, where do you see issues or problems coming up in the future for care and need for care?
So, yeah, I think when we talk about the baby boom population, for one thing, it is massive. You know, it is now the second largest in the workforce. The millennial population has caught up in the last couple of years as baby boomers retire. But each year, more people enter in retirement. And so today, we have three generations living in retirement in the U.S. and cutting across all aspects as far as the economics and the diversity of the population, you know, of who those folks are. And while the baby boom generation includes some of the wealthiest of retirees, it also includes some of the poorest. And for about half of the population, their retirement income is almost entirely their Social Security benefit. And Social Security has been a marvelous tool for keeping people out of poverty, and Medicare provides access to health care. But it can still be a struggle for folks. And for most retirees, and it's true in Greater Cleveland, Social Security represents most of their household income in retirement. And so we see people working longer than they might have a few years earlier, more people working past the legal retirement age. Typically, surveying the baby boom generation, you know, they might have thought they'd retire at 60 or 65. Now you ask people in their 60s and they're saying 68, 70 that they intend to work. For some of them, it's because they like what they do and they want to continue doing that. For some, it's an economic necessity. If they don't supplement their income somehow, they aren't sure how they're going to make a go of it. It's a population that's more likely to live alone. The baby boom generation were smaller families than their prior generations. They were more mobile. You know, they moved across the country for jobs and careers, and so families are maybe more scattered. They're more likely to have experienced divorce than prior generations. So particularly among women, are far more likely to live alone, and elderly women who live alone are far more likely to live in poverty than their married counterparts or their male counterparts. So as you think about some of the challenges for the population in retirement, you're talking about an issue that's as much a women's issue as it is an aging issue because of just the nature of retirement, the nature of how retirement income is calculated in working. People that left the workforce to have children, people that left the workforce to be a caregiver for a maybe an elderly parent, well, that impacts your lifetime earnings and it impacts your Social Security. So those become factors. Still, on the other hand, it is a population that is living longer than prior generations and generally lives healthier longer than prior generations. So it's not all bad news.
Not all doom and gloom.
So yeah, there's hope there, but it is a challenge as well. What's the quality of life? And in particular for things like healthcare, because healthcare access and the cost of care can be so expensive, those become real concerns for folks. And so let's say that when we survey seniors, we survey older adults, and you ask about financial questions, most people will say, today I'm doing all right. If you ask the retiree how you're doing today, I'm getting by, I'm all right. Other people worse off than me.
Right.
But you ask somebody, what about 5 years from now, 10 years from now? And people have a real concern about outliving their money. They have about their health failing and their ability to deal with that in the future. People are very committed to the idea of staying in their own home as long as they can. They want to stay in the neighborhood they know, around the people they know, the church they go to, the house they raise the kids in. That's a pretty universal thought. But in talking to people about that, that's what I want to do. I don't know if I'll be able to. If I'm not able to climb the stairs, if I can no longer drive a car, if I can't physically maintain the house, or if I can't financially maintain the upkeep of the property. And all of those are things that we address through some of our programming at Benjamin Rose, whether it's helping people with assessing their financial issues that may present, or the sort of health and wellness and access to the community that helps make it possible to maintain independence. And so those really help inform the services of our research and education program, of our Elder Care Services Institute, of the Rose Centers, the work that ESOP does. I mean, all of that kind of evolves around those needs and wants of that population.
Yeah, and I would say that leads right into the next question is, so many people talk about, especially between those ages of 44 and 55, of just the time, the emotion, the physical being of having to take care, wanting to take care of their loved ones and their aging parents. And all those things that you just talked about that we want, from trying to figure out, can they stay in the home? How long do they stay in the home? When do we start having those conversations? And from the majority of people, and just knowing myself, I'm sure as I get older, I'm going to get a little bit more stubborn, and I'm going to be a little bit more set in my ways. So as I've gotten older, I've kind of gotten that way. I can only see it for myself getting worse. But I know that conversation is difficult for a lot of caregivers in having that conversation. And if your parent still has a lot of cognitive abilities and are able to make good decisions, sometimes it's even harder, because physically they might not be able to stay on their own. So what are some of the things that you're hearing from caregivers, and what are some of the resources that Benjamin Rose can offer for caregivers too?
So one of the things that we know is that any older adult's ability to live independently eventually is impacted by the caregiver support network that they have. Whether you're talking about an adult with disabilities or developmental disabilities, or you're talking about an older adult maybe with some physical disability or maybe some cognitive decline, their ability to remain independent hinges in large part on that informal support network. Not the medical treatment that's available to them, but what happens everywhere else. And so caregivers report sometimes that it can be a very stressful environment for them. It can be overwhelming because they're trying to navigate a system that they don't know themselves.
Yeah.
And so there's a lot of evidence that things like hypertension and anxiety and other health issues are magnified in the responsibilities of being a caregiver. Now, despite that, most people are caregivers. most people are able to age in place. Most families figure a lot of this out, but it can be pretty lonely work sometimes. And so, we look for ways to help with the care planning, with the conversations. How do you engage as a caregiver if you don't live in the community where your parent is? How do you know they have access to services, and how do you provide them? If there are multiple siblings or multiple family members or a network of friends and family, how do you help engage those people to share the burden, share the responsibility, share the work? One of the biggest challenges in caregiving sometimes is people don't identify as a caregiver.
Right.
They just, I'm just being a good son. I help out with the yard work at mom's house or whatever it is. And so one of the challenges sometimes is just even to help a caregiver see that, well, you are caregiving, you are providing that support, and acknowledging that is a piece of, well, how can I be more comfortable with this and better able to do it? Because caregivers are also very often raising their own children, they're working, they have multiple responsibilities. We talk about the sandwich generation, where you've got your children at home and maybe a grandparent or an elderly parent that you're caring for. So a lot of work and a lot of responsibility. And very often it's a joyful task. It's something people want to do, but that doesn't make it an easy task. And so as we find ways to help support people in that setting. And so for Benjamin Rose, some of that's about caregiving supports specifically, so some of our outreach efforts. And some of it's about just educating service providers and others about, employers, for example, about the challenges that face caregivers. So as we can talk to employee assistance programs at places of employment in the community, as we can talk to healthcare systems, in addition to the conversation you have with the caregiver that says, hey, here's some things to think about, here's some things to try to do. Here's some ways you can get some additional support. Here's some resources you should know about in your community to help make that a more joyful and meaningful experience for the caregiver, as well as being an effective source of support for their loved one.
Yeah, we see that a lot with families who have children or adults with special needs that are living in the home, as well as those that are caring for their aging parents. They often, I think the statistics show that most people, like 80%, do not share any of that with their employer, or they don't talk about it at work except with maybe one or two very close friends, but it's really not something that they discuss a lot about. So the internal, stress of holding that in, dealing with it on a day-to-day basis, knowing that, there's resources like Benjamin Rose Institute on Aging, hopefully can help appease some of that. So, go ahead.
So one of the things that we just in that area of focus is about 28 hours a week is typical for a family caregiver. So a significant part-time job.
Right. That they don't get paid for necessarily.
And if they don't have some sort of relief or support in doing that, it's a 7-day-a-week, no days off responsibility too. So it can build up, and it's not something that happens overnight. You don't wake up one day with this extra responsibility. You add it on a little bit at a time, and so helping people, take that on, understand it, be effective with it. We're not teaching you how to provide care. We're helping you understand how to care for your own needs as you are being a caregiver for your loved one.
Very important, very important. Well, thank you so much, Orion. I think that, for those people who really didn't know what Benjamin Rose Institute on Aging is or does, I think we've given them a really nice overview of all the pieces that we can work with seniors, as well as community, employers, caregivers, on all those different aspects. Any place that people can go online to get more information on Benjamin Rose?
Well, we have a wonderful online resource at our website. So if you visit www.benrose.org, You'll find a whole series of community education materials and resources for caregivers, for professionals in the field, as well as information about our programs and the various research projects that we're part of. And you can also find information at that website about opportunities to volunteer, opportunities to be a donor, and help support the mission of the organization in the community. We are a local nonprofit, and so we rely on the support of the community to help make those things happen. And so there are ways that you can participate in the organization in that way as well.
Excellent. Well, thank you. And I know, just for everybody, that we have on August 7th from 6 to 7:30, we call it the Summerlicious Dinner with Chef Mario, where you will be able to virtually watch Chef Mario learn how to cook a wonderful meal. And you can do that by buying all the ingredients that they provide the list for ahead of time, and then following along and trying to make it on your own. You can do what I'm probably going to do, which is going to drink wine and watch him make it, and then try to make it later. Because it probably isn't going to turn out the exact same as what he does if I try it. But I hope you all can join us for some of those. Please do check out the website. It's www.benrose.org for more information, volunteer opportunities, and to learn how to donate back to the community. Thanks again so much, Orion, for your time today, and we look forward to seeing all the things that Bria does in the future. Thank you.
Hey, it's great to talk to you today.
Thanks.